Bismillah, alhamdulillah, Allahumma salli ala Muhammadin wa ala alihi wa sahbihi wa sallam. My name is Muhammad Ibrahim and I'm lecturer at the University of Hargeisa. In this presentation, I will discuss ultrasound evaluation of threatened abortion. Threatened abortion is a condition in pregnancy before the 20th week of the gestational age, characterized by vaginal bleeding and cramping sufficient to suggest that miscarriage might result. Threatened abortion is the most common clinical indication for ultrasound evaluation of an early pregnancy. Threatened abortion occurs in about 25% of all pregnancies. About one half of women presenting with threatened abortion have a poor outcome. All pregnant women who present with vaginal bleeding during the first trimester of pregnancy, the primary goal of ultrasound evaluation is to determine if the pregnancy is intrauterine or ectopic. If we see an intrauterine pregnancy, which means true gestational sac at the fundus, the second goal of ultrasound evaluation is to identify an embryo. If an embryo is not seen, we should correlate with the gestational sac size. Guidelines here are stating that we should see embryo with transvaginal scan when mean sac diameter is about 25 millimeters. If embryo is seen, we determine if it is alive or dead by detecting heartbeat. If a live embryo is detected, then the goal of ultrasound study is to search for sonographic findings that are associated with high risk of subsequent demise or fetal anomaly. What about if you see gestational sac without an embryo or yolk sac? When ultrasound examination shows a sac without an embryo or yolk sac, the diagnosis is limited to one of three entities. Number one, normal early pregnancy. Number two, abnormal intrauterine pregnancy. And number three, pseudogestational sac. Discriminatory level of detection of embryo is 25 millimeters using transvaginal probe. If mean sac diameter is less than 25 millimeters, then wait and follow up. Mean sac diameter increase 1.1 millimeters per day. And based on that, we can determine appropriate time interval between initial study and follow-up study. The repeat study should aim to identify both yolk sac and embryo with cardiac activity. We diagnose the abnormal intrauterine pregnancy when mean sac diameter is more than 25 millimeters and no embryo. We use terms like failed pregnancy, blighted ovum, or anembryonic pregnancy. To say it is pseudogestational sac, we need to differentiate it from normal intrauterine pregnancy. Pseudogestational sac is located within the uterine cavity, where normal intrauterine pregnancy is located within the decidua, which means eccentric position, not within the uterine cavity. This is gestational sac of 19 millimeters with no yolk sac or embryo. In this case, we need follow-up scan after 6 days, where we are expecting mean sac diameter would be 25 millimeters. This is another gestational sac with 25 millimeters of mean sac diameter with no yolk sac or embryo. In this case, we see it is more than the discriminatory level of mean sac diameter. Therefore, we can diagnose it as miscarriage. Missed abortion. The positive diagnosis of missed abortion is based on the lack of detectable heartbeat. So, when should embryonic heart activity be routinely seen in a normal pregnancy? In this study, the embryonic heart begins to beat spontaneously on about day 37, when mean sac diameter is 18 millimeters and crown drum length is 3 millimeters. Detection of a heartbeat in a very small embryo depends on the resolution capability of the ultrasound. Therefore, the inability to detect a heartbeat in a small embryo with crown drum length less than 7 millimeters does not necessarily indicate embryonic demise or missed abortion. Embryonic demise is indicated on transvaginal sonography if an embryonic heartbeat is not detected in an embryo with crown drum length that is more than 7 millimeters, equals or more than 7 millimeters. This is a video clip showing an embryo with crown drum length of less than 5 millimeters and no heartbeat. In this case, we recommend a follow-up rescan. This is another video clip showing an embryo with crown drum length of 5 millimeters, and easily we can see heartbeat. In this clip, the embryo is 11 millimeters and has no heartbeat. Therefore, we can confidently say missed abortion. Look here, Keller Doppler is used to show lack of cardiac motion. Although it is not recommended to use Keller Doppler in the first trimester, but in the case of confirmed missed abortion, it can be used for documentation. Sometimes you might see gestational sac containing amniotic membrane without visualization of embryo. Usually we don't see the amniotic membrane before embryo is 7 millimeters, and it is difficult to see the entire amnion before embryo is 7 millimeters or more. Studies are suggested that demonstration of an empty amnion is always associated with early pregnancy failure. What we see here is the amniotic membrane and yolk sac, but we couldn't see embryo. According to these studies, we can confidently diagnose as miscarriage and recommend evacuation. Thanks for watching.